So what happens if you get sick and must relocate for medical treatment, but you can't find affordable accommodations? Well, the CEO of StayWell, Sass Khazzam, joins us to share resources that you could use. Great to have you, Sass, because I know for you, you started as a volunteer at StayWell, and then you became the first full-time employee and CEO just in February of this year. So congratulations on that. Take us through what StayWell is.
Thank you very much, Tim, for that opportunity. People have to relocate to Toronto can be from anywhere in Canada in order to receive critical medical care. The medical care itself may be covered, often is covered, but how do they afford the accommodations? If it's, for example, post-treatment, they may have to stay near the hospital for a period of time. This can vary from a few days. In certain cases, for example, case of a lung transplant could be several months. If they are unable to afford the cost of relocation, they don't get treated.
So are we talking hotel rooms? Are we talking apartments? How are you helping people out?
It's a very, very good question. Thank you. Depending on the length of stay. So for those coming just for a few days, we partner with hotel groups. And for those having to stay for a longer period of time, we have fully furnished apartments. These apartments can range from 1 bedroom to 3 bedroom, depending upon the size of the family that has to come. For example, if it's just a spouse, that's 1 bedroom may be fine, but in cases where you have little children and they can't be left behind, they have to be together, we've often found ourselves renting them a 3-bedroom or 2-bedroom condo. All of these units are close to within walking distance of the hospitals in downtown Toronto.
How many other organizations are doing this?
There are other organizations that are doing something similar, but not exactly the same. A prime example for pediatric patients would, of course, be Ronald McDonald House. They only handle pediatric patients. StayWell handles patients of all ages, which also includes pediatric patients in situations where, for whatever reason, Ronald McDonald House may not be in a position to house that patient.
So how do people reach out to you? Do they have to apply for this? How do they get in touch?
So the way it works is they typically, they'll typically find out from the social worker at the hospital where they're going to be treated. They'll be provided dates when they have to arrive for their treatment and approximately how long they'll have to stay. Their social worker may provide them with information on options available for accommodations. In a number of cases, we are listed on the hospital websites as an accommodations provider. Once they get to us, our website is staywell.ca. They are able to book themselves either by using an online system or by phoning if they have difficulty. In some cases where patients have difficulty themselves or their family may have difficulty, the social workers will often book for them.
Wonderful, because you can also volunteer, you can donate, and you become a partner of StayWell by also visiting staywell.ca. And from your start in 2018, from providing 135 rooms, at the end of last year, you provided over 40,000 rooms. Wonderful work. Sass Khazzam, the CEO of StayWell. Thanks for joining us.
Thank you very much, Tim.